It's 9:15. We're going in for a healthy 2-month-old. Hello. Hi, are you having a hard time holding that head up? Is that head kind of heavy? Is that head kind of heavy?
Oh, he's like, yes.
Oh, my head is so heavy. All right, so this is our healthy 2-month visit, right?
Yes, it is.
Wonderful.
Well, healthy. He woke up with quite the cough.
He did?
He did.
Like yesterday was fine. This just started.
Yes.
Well, he must have known he was coming to see me.
That's right.
All right, I'm gonna get a cough. I'm gonna try to get a smile.
Oh, yes.
All right. Yeah. So we're looking here. The blue line's average, so the height is slightly above average, and the weight's at the 75th percentile. So that's a beautiful trend there of weight gain. And if you look at weight compared to height, this is sort of the equivalent of your BMI. You're above average, which is great to have achieved that in 2 months. There's the head circumference. She's got a big head, room for all those brains. How's the feeding going?
Really well.
Okay, and are you breast only?
Yes.
And how often, how long do the feeds take? How many feeds per day, that kind of thing?
Maybe 10 minutes and every 2 hours.
Okay, you do one side at a time?
Yes, one side at a time.
What would happen if you did both sides? Would you throw up?
Yeah.
Yeah.
Yes, you
Okay,
would.
so you have lots of milk, obviously.
Yes, we do.
And that's a nice situation, because then you can do on demand, you can do whatever.
Yes.
Perfect.
Been working pretty well.
Perfect. So we're gonna start at the top and look at the eyes. I'm looking for the red reflex, which is a little flash of red. Actually, I got a nice little look at the back of his pupil too, or at the retina. So those look normal. Are you gonna give me a smile? Are you gonna give me a smile? It's really hard to get smiles sometimes, isn't it? Hi, what you doing? You gonna make me work for it? What you doing? What you doing? Hi. Okay, I almost got a smile. I almost got one. You're really gonna make me work hard. You're really gonna make me work hard. There it is. There it is. I knew I could get a smile. All right. So I notice as he lays here like this, he's looking across at over his right shoulder. I'm gonna see if he can do the same on the other shoulder. Look over that way. Perfect. So sometimes babies have a real preference to look one way or the other, and it's because of tightness of this little muscle. Yeah, you see all that light over there? You see all that light over there? Hi. What you doing? Hi. Hi there. You're trying to look outside? Come on, I'm right here for you. What you doing? What you doing? Do you feel like he's tracking properly with you?
You know, that's one of my questions on the list today.
Yeah, because he seems to avoid my eye contact a little bit.
That.
Yeah.
And sometimes his eyes do this dart movement if he looks to the left.
Yeah, so what I'm doing now, and you can follow with me, you see the reflection of there's a little smile. You see the reflection, it's not on the same place on each eye. You see that?
Yes.
So right now on his left eye, it's closer to the pupil. Well, right now it's centered and it's good. But when he was looking away, it seems to be on a different part of the eye compared to the pupil. So here's smiling. At this particular moment, his right eye, it's more centered, and it's way off to the side on his left eye. You see that?
I do.
Okay, that's probably one eye has stronger visual acuity than the other, and it's blurry to him if he looks if his brain processes both images. So he's starting, perhaps, this is most likely, to turn off one eye, okay? And we can fix this, it's easy. It's not permanent.
Okay.
I'm gonna send you to the eye specialist, and they will figure out which is the strong eye. And then we used to patch the strong eye. So if this is my good eye, we patch it for about 2 to 4 hours a day,
To exercise.
forcing the weak eye to do its job. And then you take the patch off and they work together. I think that's all it is. Chances are.
I did notice that because with the other kids, they were always engaged,
Right.
and he kind of looks all over.
Right. So I think it's just that, and we'll make a referral. Now, let's see here. Let's see that mouth. All right. Ta-da. Okay. It's got a kind of a slightly high palate, but I don't think that matters. And the tongue is okay since you're nursing well. I think that's totally fine. I don't think we need to worry about that. You know, if you were having trouble, we could assess for a slight tongue tie. But yeah, he's moving his tongue okay. Yes, you are. Yes, you are. Hi. How you doing? Oh, is that your mommy? Did you see mommy?
You have the duck recording. I'm breathing.
Perfect. Perfect ears. Listen to the heart. Okay. Heart and lungs are good. You know that raspy, noisy stuff? That's just upper airway stuff.
Okay.
So I wiggle the hips here to do a nice abdominal exam because it kind of loosens up those muscles, and I'm able to get in pretty deep here, just feeling for abdominal masses, and everything feels normal. No problems there. Looking at tone. Oh, we got that big head as part of the problem, right? So it's like, oh, it's lagging a little bit. So the arm tone is fine. The leg tone is great. The head is just a little bit floppy, but I think it's just because we got such a big head, relative to our size. So we're gonna check for pulses. Oh, he's got nice, strong femoral pulses. That's good.
But not being circumcised, it's still, we're not touching it. We don't fold it back, right?
Right. Just leave it alone. Little boys will start to have natural erections. That starts to loosen things up. And then when you go through puberty, everything loosens up anyway because of the hormone changes that happen. So no problem there. Now we're at an age where you can start doing some tummy time. A lot of kids don't really care for tummy time because their face is sort of forced, right? But you know,
He kind of likes it.
he's okay with it, and this is normal. You know, that's how they end up learning how to crawl, kind of that pushing stuff. And eventually they start to push up and lift their head up, which will come. His head is just heavy.
It is.
It's like, because sometimes they'll see themselves in the mirror and then they'll kind of like go, oh, who's that? You know, who's that? Just, no, I'm just gonna look to the side.
He can't just yet.
He's like, so I just like to make sure there's no deep sacral dimple. We don't have any problems there.
Why do you check that?
And oh, if you have a tethered cord, you can sometimes have a dimple that you can't see the end of. Looking at legs, you'll notice there's the creases. And here, do you see the difference? These creases are closer together.
Yes.
So that's most likely all that is a slight leg length discrepancy. And it's no big deal, but it's just something we'll watch, okay? I'm gonna flip you back over there, buddy. And so we check hips, try to see if you can dislocate them, and I can't, they're nice.
That's
Nice
good.
and stable. So basically here, other than that eye issue, we've got a perfect baby.
That's awesome.
And awesome weight gain.
Thank you.
So I'm real happy with everything.
And he's just letting you do whatever you want.
I know, it's so cooperative.
Yeah, it's like looking in the mirror now, so that's good. I wonder if he'll see himself and get kind of interested in who he's seeing. Oh, can you see yourself from down there? Basically, maybe, sorta. Thanks so much for letting us film.